Welcome to the session. Kathy Mayhew is going to talk about benefits, the great benefits that we enjoy from our university. Go ahead, Kathy.
I'm going to give a very brief outline of overview of benefits. So if Kate would turn to, or we have the next slide here. So the Staff Benefits Advisory Committee is consulted on certain benefits only. The Supplemental Health Plan and Dental Plan, which is a self-funded plan set up by McGill. It's administered by Manulife, but McGill sets the parameters, and we meet with the staff benefits and the Willis Towers Watson, which is a company that helps to liaise between McGill and Manulife on costs and things like this. But Manulife does the administration work. They pay the benefits, they review them. So when you find that your benefit is denied, first go back, call Manulife and talk to them about it. There may be some form that's missing, something that wasn't clear. If necessary, ask to escalate up beyond the front line. And if not, then check the HR benefits web link in order to see what's covered. Things do change slowly, but sometimes do change. And if not, then contact HR to find out, because it sometimes turns out with more information, the benefit will be reviewed. So those two are there. There are certain eligibility requirements, and they have changed over the years. Those who retired before 2016, it continues to be a 50-50 sharing cost for these benefits as it is for active employees. Those who retired after June 1st, 2016, it's a 70-30 sharing cost where the retiree pays 70% and the university pays 13%. And the third category that already we're starting to see a few people, those who joined the university, and the dental, for those who wish to continue into retirement and are eligible, they pay 100%. The third category is people who joined McGill after June 2010, or after January 2010. While they can have the dental plan while they're active at McGill, upon retirement, they are no longer eligible for the dental plan at all. So certain eligibility requirements, you have to be at least 55, had 10 years continuous service at McGill, and have paid into the benefits for at least 10 years as well. So some who joined after 2010, they already meet those requirements. They're over 55, they put in 10 years plus, they've been in the plan for 10 years, and they can't continue with the dental at all. That was changed in 2010, 2013, when McGill was really wanting to save money, and because it's a self-funded plan paid by the employees and McGill, if to save money, if you have to lose something, it has to be lost on both sides for the university to save money. So this was one of their ways of saving money. We were lucky in the last couple of years, things were a little better, but they always look at things. It's not to be tied to inflation. It's a way of spreading costs around. It's a way to improve employees' work relationship and to employ their health so that they will continue to come to work and not be absent. So it has to be something that's for the greatest good of the greatest number of people, and that can be sustainable going into the future. So benefits cannot be taken away, but they can be changed going forward for people coming forward. The other two ones that the staff benefits has consulted on is optional life insurance and long-term disability. Long-term disability does not affect retirees. You're not eligible. In fact, people who are working after 64 and a half don't pay into long-term disability, so I'm not going to talk about that. Optional life insurance is optional. If you want to have, if you had it when you were working, you can continue, but up to now a maximum only of $100,000. And it has changed, and I'll speak about that in just a minute. A number of other benefits that the Staff Benefits Committee does not review is the basic life insurance, which is very nice. It is fully paid for by the university. And so for those who are retired and over 65, it is half of your salary at the point when you retired, up to a maximum of $30,000. The university pays that. It is a taxable benefit and shows up on your tax form. So the optional life insurance and the long-term disability are by Industrial Alliance, the basic life, and those are paid for entirely by the active employee or the retired employee. The basic life insurance is totally paid for by the university. So it's a term life insurance type policy. So you don't build up credit for being in the plan for a long time. The pension plan is completely separate. Some will continue that after retirement, some not. There's separate committees that deal with that. Other benefits that we have is email for life, your McGill.ca email, library access, either digital if you're not in the Montreal area, or physical, discounts for the, athletics. Some things do not continue: short-term disability, long-term disability, accidental death and dismemberment, and employee assistance. So now if Kate, if you just could go back one slide to the you'll see there's the web link there to the McGill website and HR and benefits. So this is something you should always look at to find out what is covered, what is not covered for the medical and for the dental, for out of province medical insurance, because it does change. And being a digital system, once it's, they don't put down when the change took effect.
I'm just curious,
it
can
just
everybody
changes.
see the HR website here?
Yes.
Yeah.
Yes,
Yeah.
okay, okay.
So it's always good to look there and to contact HR if you have particular questions. The Manulife web link, the one underneath it, everybody should be aware of that one. Have a group ID, arrange for a direct deposit. You can submit your claims online. We encourage you to submit your claims online. McGill seemingly doesn't do as much of that as some other clients. And they say that if more people submit their claims online, it's better processing for us, a quicker processing and turnaround. I know with the dental, our dentist submits it online and the very next day, the money's in the bank account. So it can be an advantage to you, but they also indicate that if more people submit claims online, they will discuss renegotiating their administrative fees and perhaps bring our fees down. And that means it comes down for the university and it comes down for us. You can also on the Manulife site, search for different pharmacies that are near you, what different pharmacies pay. My drug plan doesn't work as well for retirees as it does for the active employees. Whereas in the past, you would pay at the pharmacy and then submit your claim to Manulife and get it back. Now with the My Drug plan, it's the information is coded on the pharmacy computer and at McGill. So it'll go through and say if the claim is accepted. And if it's accepted, then you would pay the 20%. And it is directly paid to the by the insurance company to the pharmacy without going through that. Most of our drugs for retirees is covered under RAMQ, and so you will find that there is not as many pharmacies that it is set up that if the drug is refused by RAMQ, then it will go to the Manulife one and do it automatically. Some I've heard do that. In some cases, though, you may have to submit a claim online or by paper in order to do that. So if we could now go on 2 slides, Kate. Just to outline a few changes. So this here, the large amount pooling insurance for very large claims. There are a few very large recurring claims at McGill. There is one that's over $600,000 a year. A younger person, and this keeps this person alive, but it is a recurring claim. So many insurance companies group together to spread the risk. But we found that for ours with the large amount pooling insurance, the lap pooling, we were paying more than we were getting back. The first few years, we got back more than we paid. The last few years, not. And so we've looked at different ways for greater cost savings. So it's being restructured, which will give us more risk, but we hope that it will save more money. And because of increased claims in the last few years, they've been ramping up a bit since the pandemic, and drug costs have been going up. Some drug costs are very expensive, especially for biological drugs and biosimilar drugs. And the dental plan, the guide for the general dentist practitioners went up like 5%, almost 10%, another 5%, perhaps a little less next year. And so the dental costs have been going up. So I don't have the exact finalization after we reported back to HR in the fall. They have final things approved, and then it goes to the Board of Governors. So at the end of November, beginning of December, you'll get the usual email from HR outlining what the premiums will cost next year, but expect that they will go up for both the McGill Supplemental Health Plan and the dental plan administered by Manulife. For myself, the family plan under the old 50/50 cost right now is $86.85 every 2 weeks for 26 pays per year. It'll go up a little over $100, including the 9% sales tax. So for those who are paying 70/30, it's going to 70, and the 100% dental, it will go up as well. The optional life insurance, it was changed in 2023 because more people in retirement have been keeping optional life insurance, and fewer people who are active employees, the younger employees, fewer have been taking out optional life insurance in order to safeguard their families, their homes, whatever. And then during the pandemic, more people were dying. And so it went from a surplus position over the last few years to a deficit position, and the deficit was getting larger. And so Industrial Life and McGill were looking at that. So before, it was a self-funding plan, so any surplus in the plan would be kept by McGill and to be able to be used in future years, but there wasn't a surplus. It was a deficit getting bigger. So Industrial Alliance made an offer to the university that they would absorb the deficit and take over the plan, and it would be a fully funded plan tied to their standard rates of mortality and tied to age brackets. It was always tied to age brackets, but the differences weren't as much. So they were restructuring them more in line with mortality costs, and on the whole, older people die more often than younger people. And so for the younger people, their cost became a little less, and for the older people, it became more. So it was a 3-year guaranteed rate for 2023, 24, and 25. So next year, there's no change in the rates. However, because they are age tied, if you change an age bracket, your rate will go up. So 70 to 74 is one cost per $1,000. And then at 75 to 79 is another. And it nearly doubles at that price. So 75, 80, 85, the costs go up a great deal. So you can check on the HR benefits site under the rates page, and you'll see what it is. With optional life insurance, it's optional. It's always a good idea now and then to review it and determine if you still need this insurance. And it can be for different reasons. You may have a much younger partner. You may have a disabled child. You may want to leave money to charity. But on the other hand, you may find that you are on your own. You no longer have a spouse. Your children are grown up. The house is paid off. You'd rather use the money yourself rather than leaving a legacy to someone else. So you can always reduce it or stop it altogether just by contacting HR. But once you retire, if you had optional life insurance, you can continue it, but to a maximum of $100,000. You can't increase it, and if you give it up, you can't get it back. So the costs are likely going to go up very much again in 2026, unless a lot of people did not stop dying at the same rate, because the 3-year guarantee will be up, and if they're still paying costs and they've absorbed that deficit, it may go up again. So there was a big change in 2021. Sorry, back up to the second one. The personalized medicine is for very few people. There are some who've had depression, ADHD, drugs haven't been working for them. There's a possibility by filling out a questionnaire of having a personalized genetic testing to find a more personalized medicine that will work for you. Seemingly, people are quite happy with that, the few people that qualify for that. Diagnostic tests went up from to $1,000 from $750. So that's good. It's only for people who live in Quebec, who are resident in Quebec. It's for Quebec private labs or clinics. Not if it's done in the doctor's office, but in some cases, if for blood tests, MRI, certain tests, you can get some money back from that by submitting it to Manulife. We talked about the life insurance, and then additional psychological providers, qualified social workers, family therapists, as well as psychologists and so on. So that has now been increased to $2,000, 80% up to a maximum of $2,000 per person per benefit year. In looking at the claims, prescription drugs are the largest amount that is paid for under the supplemental health plan. Not a lot for retirees because most of our drugs are covered under RAMQ. The next largest one under the paramedical ones is mental health claims, psychological and other ones. So that is very large. And then physical therapy, occupational therapy, and so on. If we go on to the next page, please, Kate. Anti-obesity drugs coverage, more drugs were expanded and being covered, and the lifetime annuity increased to $2,400. Now, this does not include Ozempic. Ozempic is covered, but only for type 2 diabetes, and it has to be approved. And that's for both the McGill Supplemental Health Plan under Manulife and under RAMQ. So Ozempic for anti-obesity at the present time is not covered, but among the drugs, Ozempic has now moved into the second highest amount that McGill pays for that. Most of the others are specialty drugs, biological drugs that are very expensive. The next one there, the McGill 65 plus plan. For those who were retired a long time ago, there was a plan. It was not very attractive. Most people declined it. Over the next few years, nobody ended up being in the plan, so there wasn't one. And then the government says, whoa, you have a prescription drug plan for those who are under 65. You have to have one for those who are over 65. So it took them a few years to work back and forth with the government as to what they could do and how they felt they could charge it fairly. But because RAMQ can command with the pharmaceutical companies a good price because they're doing it on behalf of a very large number of people. They get a good discount on that. And McGill doesn't want to be caught on the wrong foot and find out they're having to pay a large. So there is a premium for this. So it's not just the regular supplemental health plan. Anyone who wishes to choose the 65 plus plan would have to pay an additional premium in addition to the supplemental health plan. And it is very expensive for really no extra cost. So it's recommended to stay on the RAMQ plan. At age 65, the university automatically changes you to the RAMQ plan, and your spouse and any dependent children, if you have any, are also changed over to the RAMQ plan. If the other person has an option of a prescription drug plan under their company, then they have to sign up under that. Otherwise, they have to contact RAMQ and saying they're now on the RAMQ plan. So on the RAMQ plan, it does cost you more because there is a monthly deductible and then a copay of 30%, not the 80% that you get back from Manulife, and you have to pay a premium on your income tax. So that changes from before checking the box saying that you're covered by your employer's plan, you now have to pay into that. So there is that, but we do recommend you also keep the supplemental health plan in case of very expensive drugs that you might need in the future, and other things such as physical therapy services, psychological services, and the out of country, out of province emergency medical insurance part of it. So you do pay extra for that. So it shows you on the McGill site what are the different costs for one and the other, but it costs much more. And so we don't recommend that. And I don't think there is anyone, in fact, who in recent years has chosen the McGill 65 plus plan. Audiology services, after many years of being requested by one of our members and being brought up over and over, is now covered for hearing tests up to a maximum of 80%, but it's a combined benefit along with physical therapy, occupational therapy, athletic therapy, and speech therapy. So the $750 envelope doesn't not necessarily go very far. And then in 2021 as well, the Pay Direct, as I had mentioned that, where at the pharmacy, some people will now only pay the deductible part, the 20% of the Manulife part. My drug plan, where you can check out what pharmacies are near you, you can check out what they pay for it, pharmacy saving search tools. I haven't always found that it's worked all that well with a particular drug, but you can try that out. And sometimes you have a relationship with your neighborhood pharmacist, and even if it costs a little bit more for their service charge, you feel that the service is worth it. And others, you can see that different pharmacies charge different prices, not for the drugs itself, but for their service fees. And you may find that it's worthwhile to change to another pharmacy. The dental plan, not as many changes, but one that we are very happy to have after many years was to have an increase for those eligible dependent children under the age of 21 who need orthodontic care, because it was for since 2007 or 8, I guess, and there had been no increase, and the costs have been going up. So even though it's only 50% for a lifetime maximum, it's now been increased to $3,000, still far less than what most people will end up paying if their child does need braces and retainers and so on. But it is a bit better cost for those people who do need it. And then composite fillings, for years and years, it would only be that they would only pay for the amalgam fillings and the composite fillings, unless they were in the front teeth, they weren't covered. Now the composite fillings will be reimbursed for all teeth. So there's not a lot of changes. We still ask them for things. We've been asking to have an increase in the $2,000 maximum for dental for several years. They do check to see what other companies are insured for within the mid-range there. We say it hasn't been increased for many years. Say it's not to do with inflation. It has to do with spreading the costs and so on and so forth. So we're going to bring it up again next year, or the new MURA representative and the other representatives from Minasa, Maut, Manaka, Amuse, and so on will bring it up again. If the university is experiencing hard times financially due to restrictions put onto it by the provincial government, they're going to be less open to wanting to make changes, because it has to be something that is sustainable for years and years going forward. They can't put it on for 1 year only. So there's only about 500 people out of the 8,000 people in the entire Manulife dental plan, and that reached the maximum of $2,000 a year. But for those people, an increase could be helpful. And also, sometimes people can spread their dental work out a bit, not for something like orthodontics, which is based on the full treatment, but for some things, if you have a crown and then need something else, you might be able to do one year and put the other one off until January of the following year, and starting over with a new $2,000 envelope to work with. So we do work on things. We are consulted, but the university, HR, and the Board of Governors has the final decisions in it. And so it is a committee made up of Maut members, MURA, Minaka, Minasa, Amuse, the researchers. So there's 13 people on the committee, plus those from the university and those from Willis Tower Watson who do negotiate with us to keep it down. So that's that part that I just wanted to update you. There's not a lot, but whenever you have a question about something, you know, there are online tutorials on how to do the online claim submission, and you can check with things and do call Manulife. It's been a bit easier to get through to them than it was for some time, and question why they're turning it down and see if it can be reassessed. And you can always go to HR and contact Charles or the people at the HR service desk. Geneviève Leroux is the manager of disability manager and benefits manager. At the present time, John DeGata is the director of pensions and benefits, retiring soon. I'm not sure if it's actually taken place. And so you can always contact them and get more information as well about why this was turned down. You can also contact your MURA rep. I will inquire on your behalf, or I may have an answer. You know, some things it comes up with, well, this is the standard general practitioner's dentist fee guide. And so if your dentist charges more, instead of it being covered at 100% or 80%, it's only covered at this amount. Or for some other benefits, if they charge more than others, that's their standard fee cost, and so it can be difficult. So Pat Force wants to know how to access the online tutorials. So you go to the Manulife web link, the group benefits plans, and you will see there's a tutorial on how to submit a claim online and how to access the pharmacy search tools and things like that. So it is fairly self-explanatory. And if not, then, you know, Kate can help organize another session on showing people how to do it, but it is fairly straightforward. So I wanted to leave lots of time for questions for you, because I'm sure people have different questions about their experiences and coverage.